Information from http://www.herald-dispatch.com. Flu activity worsens in West Virginia, Ohio as peak approaches. Huntington, the nation's Centers for Disease Control and Prevention has upgraded West Virginia's flu activity from sporadic to local activity this week, while Ohio has reached the highest widespread designation. In Kentucky, regional activity, the second most severe level, has been reported for the past 5 weeks. West Virginia's baseline activity remains just above the baseline recorded in October, according to the State Department of Health and Human Services, though flu season is expected to peak anywhere between early January and mid-February, as it has since the 2014 season. In Ohio, flu activity appears to be climbing toward its peak a few weeks sooner than the 5-year average, according to the State Department of Health. An estimated 150 people have been hospitalized due to the flu in the Buckeye State already this season, which normally peaks in early January. In Kentucky, at least 171 lab-confirmed cases of the flu have been reported this season, according to the State Department of Public Health. At least one flu-related death has been reported. The CDC grades a state's flu activity on 5 levels: no activity, sporadic, local activity, regional and widespread. The most effective prevention against the flu remains a simple vaccination, Dr. Rahul Gupta, Commissioner for the West Virginia Bureau for Public Health and State Health Officer, previously told the Herald-Dispatch. The vaccine even mitigates the symptoms should an individual contract the virus while under inoculation. Tens of thousands of West Virginians are hospitalized with the flu each year, he said, and a handful die from the disease. Flu does not directly spread due to cold weather, Gupta said, but through human contact, chiefly through the ear and hand-to-mouth contact. There is, however, proof the flu spreads as humans spend more time inside due to the cold weather, spreading rapidly as families travel during the Christmas season and as children return to school from winter break. Those most at risk and in need of vaccination are those at the extremes of young and old age, pregnant women, and those with medical conditions that compromise their immune systems. Flu vaccinations take effect by preparing an individual's immune system to attack the virus by injecting the system with proteins from dead viruses. This primes the system to create antibodies to attack should a live virus enter the body. Season's first flu-related death in region reported as officials warn of increased cases. The Department of Public Health and El Paso Fire Department held a vaccine clinic on Wednesday, February 15 at the EPFD's Safety and Health Outreach Center, 5415 Trowbridge Drive. The next event is February 26, from 1 until 5:30 p.m. Rudy Gutierrez/El Paso Times. A woman in her 50s has died of the flu, making this the first flu-related death of the season in the area. Officials with the city's Department of Public Health this week said that the woman, whose identity was not released, had underlying medical conditions and had not received a flu vaccine this season. It is never easy to report this type of news, especially so close to the holidays, Public Health Director Robert Worsens said in a news release. Unfortunately, flu cases will likely increase as we celebrate the season, which is why it is so important that those who haven't received their flu vaccine to get their flu shot now. City officials said there has been an increase in flu activity reported locally and across the nation. The flu season in El Paso runs from October to May, generally peaking in January and February. 3 flu deaths were reported in the last flu season that ended in May. In the 2015-16 flu season, 6,144 flu cases were reported in El Paso County, compared to 5,844 the previous year. The flu vaccine is recommended for everyone 6 months and older, including pregnant women. It takes about 2 weeks after vaccination to fully develop protection against the flu, officials said. There are 4 steps that can help prevent the spread of the disease. Clean, wash your hands often. Scrub your hands for at least 30 seconds with soap and water, or use an alcohol-based hand cleaner. Cover your cough. Use a tissue to cover your mouth and nose when you cough or sneeze. Don't have a tissue, the crook of your elbow will do. Contain germs by steering clear of others who are sick. If you do get sick, stay home until you're well again, so you don't spread more germs. Call or see your doctor if you or your child has a fever greater than 100 degrees. The health department is encouraging residents to call the city's 2-1-1 number to find a flu vaccine provider. For more information, visit www.ephealth.com. Information from Dallas News. 2 more flu-related deaths in what could become one of our worst seasons in Dallas County. 2 additional flu-related deaths were reported Wednesday in what could become one of Dallas County's worst flu seasons. A 73-year-old and an 80-year-old were the second and third people to die after complications from the seasonal flu. Last week, a 98-year-old died after contracting the illness. On a national scale, this season is on track to be one of the worst in years, and Dallas looks like it might be following suit, said Zachary Thompson, director of the Dallas County Health and Human Services Department. The county is seeing a spike in cases much earlier than in previous years. It could be that we're going into one of our worst seasons, Thompson said. Right now it looks to be a real serious flu season, and so we need to make sure everyone practices steps for prevention. We're seeing an increase in our flu cases, so that is a concern. Flu cases are on the rise across Texas, according to the Centers for Disease Control and Prevention. The state is one of 4 that has experienced a high activity of influenza-like symptoms, according to a Centers for Disease Control and Prevention report that covers the week ending December 9th. As of that date in Dallas County, around 17.1% of flu tests reported to the CDC came back positive for the virus. That is close to twice the national average of 8.4%. Nearly 400 people in Dallas County have been hospitalized with the flu since September. That's nearly 5 times the number of cases during the same period last year. During the week ending December 9th alone, 96 people in the county were hospitalized. During the same week last year, only 3 people were hospitalized. I think there's much more to come, Thompson said. What compounds it is why we always push people to get the flu shots before the Thanksgiving holiday. It's really the travel to those areas where there are flu outbreaks. So if you're traveling to another part of the US where there's a flu outbreak, the close proximity to people will contribute to the virus being transmitted. At least 1 Texas child has died in a flu-related case, the San Antonio Express News reported. The 3-year-old, who died in mid-November in south-central Texas, had no underlying health conditions and had not gotten a flu shot. Closer to home, the entire Sunnyvale School District shut down for students 2 days earlier this month because of a flu outbreak there. We definitely haven't reached the peak. Flu season usually peaks in January or February, when kids and adults return to school, work and their routines. But because of the way cases are trending so far, Thompson said the county could be in for a long haul with the season peaking in February or March. While you can't predict how the flu season will go, Thompson said so far the season is looking to be pretty serious. We definitely haven't reached the peak. Although the county has plenty of vaccine to go around, Thompson said it seems that fewer people are getting flu vaccinations this year. The shot's effectiveness varies each year, but recent studies show the vaccine reduces the risk of flu illness by 40% to 60% when the strain of the virus going around is well matched to the vaccine, according to the CDC. The CDC recommends yearly flu vaccinations for everyone older than 6 months, although there are rare exceptions. Adults 65 and older and children younger than 5 are at high risk for developing flu-related complications. Pregnant women and people with certain medical conditions are also more susceptible. The adult flu vaccine is available at the Dallas County Immunization Clinic at 2377 North Stemmons Freeway, and the children's vaccine is available at all Dallas County Health and Human Services immunization clinics. No appointments are necessary. Do your part to prevent spreading the flu. Get a flu shot. Cover your cough with a tissue or your sleeve. Don't go to work sick, and don't drop off a sick child at a child care facility or school where infections can spread quickly. Wash your hands often and keep your hands away from your face. Source: Dallas County Health and Human Services.